All right, we're going to talk about something called atrial fibrillation. You've probably heard it called AFib. It's actually the most common heart rhythm disorder out there. In this explainer, we're going to break down what the latest medical guidelines say, but in a way that's super simple and clear so you can really get what's going on. So, have you ever had those moments, you suddenly feel a little lightheaded, or maybe you're just exhausted for no good reason, or that weird feeling that your heart is just fluttering? Well, it turns out those vague, subtle feelings can actually be the very first clues that point towards AFib. So here's how we're going to tackle this. First, we'll cover what AFib actually is. Then, and this is crucial, we'll get into its biggest risk, stroke. After that, we'll walk through how it's diagnosed, look at the modern 3-part treatment plan, and wrap up with a key decision that you and your doctor might face about medication. Okay, so first things first. What is atrial fibrillation, really? What does it even mean when we say there's a quiver in your chest? So let's get right into it. In a healthy heart, the top 2 chambers, the atria, give a good, strong squeeze to push blood down into the bottom chambers. Simple enough, right? But with AFib, those top chambers just quiver. It's chaotic. Some doctors have described it as looking like a bag of worms. That chaos creates an electrical storm that bombards the main pumping chambers, making your heartbeat irregular and, a lot of the time, way too fast. And this isn't some super rare condition. AFib is the most common heart rhythm problem people have, affecting about 1.4% of everyone. But that number is a little misleading, because the real story here is age. For people under 45, it's almost unheard of, less than 0.1%. But then it just climbs and climbs, hitting nearly 16% for folks over 85. That's a huge jump. And here's something the guidelines are really clear on. AFib almost never just shows up out of the blue. It's not an isolated problem. A much better way to think about it is like a check engine light for your heart health. It's telling you something else might be going on. That's why managing these other risk factors is every bit as important as treating the rhythm itself. So, that brings us to maybe the single most important reason AFib is taken so seriously. It's not just about the dizziness or the palpitations, it's about preventing something truly devastating, a stroke. So here's what happens. Because those top chambers are just quivering instead of pumping, blood doesn't get fully squeezed out. It pools. It gets stagnant. And when blood pools like that, it can form clots. Now, if a little piece of that clot breaks off, it can get pumped out of the heart, travel straight up to the brain, block an artery, and that's what causes a major stroke. So how do doctors figure out your specific risk? Well, they use this really simple but powerful checklist called the CH2-DS2 VASC score. You just go down the list, and each condition adds points to your score. You'll notice the really big ones, having a prior stroke or being 75 or older, those are the heavy hitters. They each get you 2 points. The higher your final score, the higher your risk of stroke, and the more likely it is you'll need treatment to prevent those clots. Okay, so you might have the symptoms, and you definitely understand the risks. But how do doctors know for sure that it's AFib? Well, the good news is the process for diagnosing it is actually very straightforward. It all kicks off with something anyone can do. Seriously, the medical guidelines say it starts with a simple pulse check at your wrist. If it feels all over the place, not just fast, but totally erratic and unpredictable, that's a huge first clue. From there, the definite yes or no comes from an ECG, which basically just records your heart's electricity. It has to show that chaotic rhythm for at least 30 seconds to make the call. And what if your AFib comes and goes? Well, in that case, your doctor might have you wear a portable monitor for a day or two to catch it in the act. So once AFib is confirmed, what's the game plan? Well, modern treatment isn't just about throwing one pill at the problem. It's a really comprehensive strategy, and it's built on 3 solid pillars to manage every single aspect of the condition. And here they are. Pillar 1 is all about preventing a stroke by using medication to stop those dangerous clots. Pillar 2 is about managing your symptoms, feeling better, which might mean controlling your heart rate or trying to get you back into a normal rhythm. And pillar 3? That brings us right back to the beginning, tackling all those underlying risk factors like high blood pressure that were contributing to the AFib in the first place. Okay, let's zoom in on that first pillar, because for most people, it's the most critical one, preventing blood clots. This usually means taking a type of medication called an anticoagulant, or a blood thinner. And this is where a really important conversation between you and your doctor begins. Now, this is a really big deal, and where the latest guidelines have made a huge shift. For people who are newly diagnosed with AFib, the go-to, first choice medication is now from a newer class of drugs called DOACs, which stands for direct oral anticoagulants. This is a massive change from the old school medication that was the standard for decades. So let's put these two head to head. You can see the differences are pretty huge in real-world terms. The newer drugs, the OACs, are way simpler. It's a fixed dose every day, you don't need regular blood tests, and there are way fewer things that mess with them. Most importantly, big studies have shown they cause fewer dangerous brain bleeds. On the other side, the older drugs like warfarin, those are the VKs, they've been around forever, so we know they work, and their effect is easy to track with a simple blood test. But here's the bottom line. No matter which medication is chosen, the benefit is just profound. Let this number sink in for a second. Taking an anticoagulant doesn't just nudge your stroke risk down a little bit. It slashes it by about 2/3 or 65%. That is one of the single most effective preventive treatments in all of heart medicine. It's a true game changer. So we'll leave you with this to think about. At the end of the day, understanding AFib is about seeing it as more than just a quirky heart rhythm. It's a signal. It's a call to action from your body to look at the whole picture and make sure you're taking care of all three pillars: preventing clots, controlling symptoms, and treating the root causes to build a truly healthier heart.